this is Amy. These are a pair of eyes that became blind after being infected with COVID-19. And these are her eyes seeing again only after the first acupuncture treatment. Isn't it amazing? Today, let's talk about why acupuncture treatment for post-COVID-19 sequelae is that fast. Since the outbreak of the COVID-19 virus in 2019, it has brought endless troubles to our health and lives. Although life seems to have returned to normal today, very strange and lingering after effects of COVID-19 continue to affect many people. Oriental medicine not only can treat the COVID-19 patients during the pandemic, but also I would like to share with you some cases I've seen in my clinical studies in which acupuncture plays an important role in treating post-COVID-19 illnesses. So please like and share this video and follow my channel. Let's get started! Acupuncture treatments for COVID-19 sequelae number 1, vision loss. Let's take another look of the eyes of the patient at the beginning of the video who became blind after getting COVID-19. The reason why Oriental medicine treatment is so effective is because of its precise diagnosis of symptoms. It's like having the same abdominal pain, but the cause for each person is different. So, if we find the right roots of the illnesses, the treatment can be very fast and accurate. For patients with eye diseases, as stated in the Yellow Emperor's Classic of Medicine, it is said, the essence and vital energy of the 5 organs and 6 viscera, or fu, all ascend to the eyes, making them bright. However, when the essence and vital energy are insufficient, the organs and fu will be imbalanced, and the eyes will not be nourished adequately. This will naturally lead to various eye illnesses. Based on this patient's tongue appearance, it can be observed that she has congenital kidney qi deficiency, insufficient heart blood, abnormal liver and gallbladder metabolism, as well as inner ear imbalance, poor blood circulation in the shoulders and neck, severe brain energy deficiency, and poor sleeping quality. This indicates that the cause of her sudden blindness after getting COVID-19 is not a singular factor. So, how does Oriental medicine treat this? The theory of acupuncture in Oriental medicine utilizes the 12 regular meridians and 8 extraordinary meridians that are spread throughout the human body. It follows the principle of crossing meridians and distant needling. In general, when treating diseases, the acupuncturist chooses points on the healthy side of the body and further away from the affected area to achieve better effect. It is essential to know that simply needling the area of pain is not considered a proper practice of traditional Oriental medicine. This meridian circulation diagram can clearly demonstrate that the meridians passing through and around the eyes mainly involve the stomach meridian of Fu Yangming and the gallbladder meridian of Fu Shaoyang, the Sanjiao meridian, and bladder meridian. Among them, the Sanjiao meridian has a branch that ascends from the chest, passes the point Chupen or ST12, goes along the neck, connects to the area behind the ears, and then winds around the cheeks to a lower eye orbit, while another branch directly connects to the outer corner of the eyes, where it joins the gallbladder meridian of Fu Shaoyang. For this vision loss patient, due to kidney deficiency and insufficient kidney essence, combined with the fact that the liver channel is closely connected with the eyes, the selected acupuncture points should focus on the distal points of these meridians in hands and feet. Finally, leaving the Jiming point for connecting should be sufficient. This patient had a scattered look in her eyes before the acupuncture treatment, and her eyes could not focus at all. She cannot even see the face of the doctor sitting in front of her. After doing the acupuncture and leaving the needles in for 30 minutes, she sat in the same seat and happily said to my father, "Dr. Lu, I can see your nose now, and I didn't realize that you don't wear glasses." Everyone there was also very surprised and happy. At this moment, the joy I felt as a doctor is the greatest happiness. Acupuncture treatment for COVID-19 sequelae number 2, hearing loss. Here are 2 patients who experienced hearing loss after getting COVID-19. Through looking at their ears, we can analyze that this patient is a bit older but has been very hyperactive since childhood and has weak qi and blood with long-standing accumulation and blockage of phlegm dam. This has caused insufficient kidney essence. In the book Su Wen, it mentioned that the kidneys are closely connected with the ears. In the book Ling Shu, it is also mentioned that kidney qi goes to the ears. The ears are connected with kidneys. When the kidney essence is sufficient, the hearing is sharp and keen. But when the kidney essence is deficient, both ears lose their hearings. The second patients here, as we can observe, show evident signs of liver fire flaring up with symptoms of phlegm heat and blood stasis. Upon further examination, we noticed she also had blood heat, abdominal distension, and inflammation in the stomach and intestines. Such a patient with hearing loss may also experience tinnitus or the sensation of wind blowing. Therefore, in addition to treating the kidneys, the treatment plan should also focus on clearing heat and inflammation. Moreover, since the senjiao is interconnected with the kidneys, clearing and promoting the function of senjiao is also a very effective therapeutic direction. Even though both of them have similar symptoms that cause them unbearable pain and distress, the underlying cause of their condition are completely different. One is due to a deficiency syndrome, while the other is due to an excess syndrome. The patient with an excess syndrome was cured after only one treatment using purging methods. The other patient with deficiency syndromes needed tonification treatments, and it only took 4 times for complete recovery. Acupuncture treatment with accurate diagnosis and precise acupuncture points can yield remarkably fast and impressive results. Acupuncture treatment for COVID-19 sequelae number 3, loss of smell. The diagnostic methods of Oriental medicine does not rely on any instruments. Instead, it uses the methods of observation, auscultation, palpation, and questioning to assess the patient. A traditional Oriental medicine practitioner will not ask the patient, "Where do you feel uncomfortable? How is your appetite? How well do you sleep?" Instead, they will diagnose the patient themselves and inform the patient the existing issues, saying, "You currently have this, and this problem. Which one do you want to prioritize in your treatment?" In Oriental medicine concept, the best doctor is to know the disease just by observing the patient. The second level is knowing the disease by using auscultation. The doctor that diagnoses the disease by palpation is considered skilled, and the ones questioning patients are just considered as operators. In Oriental medicine, there are mainly 4 methods of observation: facial, palm, tongue, and ear. My father trained my sister and me to be able to instantly recognize the overall health condition based on just a single part of the body. This is a picture of the tongue observation of a patient who lost her sense of smell after having COVID-19. In her daily life and work, she has strict requirements for perfumes, so the loss of her sense of smell is something she finds unacceptable. So diagnosis and treatment plan for her are based on the principle of the lungs govern the skin and hair and are connected to the nose. By comparing the tongue images before any treatment and after the second treatment, we can observe in the first image that besides the loss of smell in the nose, the patient had tense muscles throughout the back, shoulder, and arms. There was also stagnation in the liver and gallbladder qi, accompanied by feelings of depression, fatigue, and exhaustion. While in the second tongue image, these issues have visibly improved. We know that COVID-19 is a type of pneumonia, and its main target is the lungs. When the lung qi is impaired, it can naturally affect the functioning of the nose. Additionally, the lungs and large intestine are pairs in Oriental medicine concept. Therefore, the primary treatment channel involved are the lung meridian of Han Taiyin and the large intestine meridian of Han Yangming. Furthermore, the theory of Han and Fu Yangming channels being interconnected also indicates that the stomach meridian of Fu Yangming, which is rich in qi and blood, can also be a good assistant in the treatment. After a single acupuncture treatment, the patient excitedly called the clinic upon returning home, saying that she can smell the cheese in the fridge again. The secret of herb medicine lies in the proper dosage of herbs, while in acupuncture, it lies in the depth of needle insertion. After needling the same acupuncture point, there should be various degrees of sourness and distension sensations for it to be effective. We call this obtaining the qi. Acupuncture technique is like the battlefield strategies. With the doctor being the commanders, patients should adjust their daily routines and lifestyle, cooperate and follow the commander. Let's together ensure you a healthy body.